Hello and welcome to Rogers TV COVID-19 special programming. I'm David Shearman. Today is Tuesday, April 7th, and I'm talking to Dr. Ian Arra, Medical Officer of Health for Grey Bruce. Dr. Arra, welcome.
Good morning, David.
Now, since we talked last, there have been a lot of changes in the situation with COVID-19. Where is Grey Bruce at right now as we speak?
So as we speak, there are 26 cases, and there are 7 of them in healthcare providers. There's one outbreak in one nursing home, and the most recent cases have been mostly not related to travel, which confirms the community outspread or the community spread that we have in Grey Bruce. All in all, the reports that I received from different levels in the municipality, from the public, and most importantly from enforcement agencies, tells me that the majority of the public is abiding to the recommendation of social distancing. In some areas, the report is 100%. There are a couple of people who require some education and some direction, but what we hear in the social media about the number of people who are not abiding or the significance of it might be a bit exaggerated, something that's not unexpected when we're looking at sources from social media. And that's why I would redirect the public again to credible sources, whether it's the health unit or the Ministry of Health. In general, this is where we are. We are in a relatively good spot comparing to other areas. We have the systems in place, we have public that's aware, and we have committed local political leaders.
Yes, I just wanted to reemphasize as well that people really are doing the right thing. I happened to be out grocery shopping this morning, my once a week grocery shop, just to reassure you, I'm also trying to do the right thing. But I was astonished at how well people are following directions. They're keeping their distance. There are spending a minimal time in the food store. It was a really I'm going to say almost a pleasant experience. Yeah, and people were actually having conversations 6 feet apart or more. And that was nice to see too.
Yeah, and it will be great when people also exercise this social distancing through the period we're in. It's the family gathering for Easter. There are many ways to keep in touch with family that is still within the social distancing recommendation, and people can use the phone, dinner gathering through the phone or through electronic means, FaceTimes and other things. It is really important to keep that connection with the family. It's essential. The pressure of being separate is not easy. So having that balance between the two goals is essential. And I would remind people to be mindful of this.
Yes, I think people are discovering new ways to keep the community connected and the family connected. I'm hearing stories, purely anecdotal, I might add, from friends who are actually planning to gather together at a particular time and to use electronic means to connect with each other and have a great family reunion electronically. So if that's an option for people, certainly that does seem to work. The world is changing right now, and we seem to be adapting pretty well.
Right. And David, there's a media release that we issued yesterday, and I hope it's going to address the concern in the public. It's we always issue these media releases out of response to a need, and there is a need to ask why don't we public health release the location of specific cases that we identified. And again, I would reassure the public the fact that cases are identified. This is the least concerning, because these people are communicated with on daily basis. We monitor where their location is, and if there is any indication that compliance is in question, we have different means to gradually increase the intrusiveness of ensuring compliance. We have plans to, like always, to connect with enforcement agencies to actually ensure this if the need be. I would reassure the public that all 26 cases that we have are in compliance, and anxiety, whether it comes from social media or from just mere fear, is not warranted when we have all the facts that we need. More specifically, there anxiety about what if cases did not disclose their symptoms or did not disclose their COVID status. And again, I would reassure the public that there is robust communication between public health and the healthcare system. And if these things happen, they will be addressed. And all of us in this together. There's no really good reason for anybody to hide their symptom, especially when they're talking to healthcare provider. However, if some people, for whatever reason it is, the case was B, we have the protocols to address it.
Yes, I think that's a very, very good point, because we've had a number of, certainly I've seen on social media the stories, but people still have a right to privacy, and they do have the right to do the right thing, and they seem to be. I think your use of the word anxiety is a very good one, because my sense is that there is a fair amount of anxiety out there, and yet the risk continues to be relatively low, it seems. And people who need to isolate are doing the right thing, and the rest of us are doing the right things too: social distancing, washing our hands, and making sure that we keep those things all in our minds right through.
That's exactly it. You summarized nicely. Washing our hands, keeping the social distancing. It just, when I look at the social media, the internet gave us unparalleled power to communicate and stay connected, including this conversation right now. But like any power, if somebody's not going to use logic, it might be harmful in many ways. When I see there is anxiety about a specific grocery store in our area that a case was identified there, and people went up in arms. What happened in that store? Well, there is a case of COVID walking around the community in every town. We need to assume that every interaction we have is COVID. So why the focus on one case that was actually identified and dealt with in a proper way? Well, there's a question why the store was not shut for 2 days for deep disinfection. I honestly don't know what deep disinfection means. COVID is a very fragile virus. Even alcohol, 60%, that's like as strong as vodka or some types of vodka, would destroy it in seconds. When we see COVID cases in healthcare setting, in a clinic, the recommendation after seeing that patient is to wipe the surfaces with mild disinfection, the same products we use in our home. It doesn't have to be 24 hours. It is not a measles case where you need to close the location for 3-4 hours. So again, if there was something to be done about any case identified, I would like to reassure the public that it was done and over and beyond. So let's focus on going forward with social distancing, with communicating with our beloved ones to ensure they have the proper means, whether to check our own neighbors. These are the conversations that we need. Like our older population, our vulnerable population deserves better conversation than what happened in a specific grocery store and why not the information is not released where people are, and whatever other situation that really, as long as causing anxiety to public, we need to address it. But that anxiety should be based on facts, not fear.
Well, I am seeing, as I go out to walk the dog, I am seeing people spending more time waving at each other and speaking more loudly to each other. Conversations are not necessarily as private as they used to be, but they're actually and quite substantive. You talk to your neighbors a bit, you find out how they're doing. Those are the good things. I wanted to move on to something that the Health Unit released today on the 7th. There was a press release on ticks and mosquitoes, and maybe you could speak to that at this point.
So certainly that's one thing was on my list. We keep receiving reports for good reasons. You know, the spring season is coming, and people would like to have some walk outside of the house. And the question is the virus transmitted through ticks or mosquitoes? And the simple answer is no, absolutely no. This family of viruses cannot be transmitted through any mosquito. It's not like Lyme disease. So I would reassure the public 100%, you know, you go for a walk with your dog in a space that's green or outside of the door. There's no outdoors. There's no need to worry about mosquitoes or ticks.
That's great. That's great. Yeah, ticks and mosquitoes have enough issues for us to worry about without having to worry about COVID-19 on top of that. What about family pets? That's been one of the issues as well. Any comment on whether family pets are something we should be aware of or concerned about?
So there has been some studies from the short period in China about whether pets could be infected with COVID. Uh, the evidence says it is unlikely. For dogs, it is very unlikely. Some experiments showed that cats might be susceptible, but it's not enough susceptibility to cause transmission from a cat to a person. Rather, under lab circumstances, there is some evidence cats could get the disease. Um, and in general, when a person's walking their pet outdoors, to be cognitive to keep distance from other animals and from other people for many good reasons, whether it's dog bites or cat scratches and other things. In the middle of the outbreak, transmission, there are no reports from transmission from a pet to a person, whether it is the pet infected, there's no report of it, or from touching a pet that was touched by somebody else. However, better practice, let's keep distance and social distancing to the complete level. If somebody is close enough to another person that the pet is being touched by the other person, odds are social distancing of 2 meters is not there anymore. So let's keep the 2 meters. That will be a general rule for everybody, and including pets.
Sounds good. Are there any other specifics that you have in mind today?
I have an issue that came to my attention a couple of times. Many people, not many people, few people called to say, we have an outbreak in a nursing home, and the nursing home is posted on a health unit. Is this a concern for my family? Is this place not doing the right thing? And I can reassure the public, I looked at the record for the past years. They have top-notch practice. As a matter of fact, their director had been sitting at the committee to refine the protocols we have for all nursing homes across Great Bruce, and they have done an amazing job and contributed well. The fact that this facility had the first infection does not speak to the level of care in it. Rather, it could be just the draw of the luck that this happened. We hope we're not going to see it in other facilities, but the odds are it's going to be in other facilities. And again, there's a layer of public health working with every one of these facilities. And, the risk to the person in the facility is similar to any other facility that we've dealt with. Many of the nursing homes that we deal with have records for years with us, and more or less all of them are in good standing. The one that was addressed in the media has actually a very good record.
Yeah, I'm glad to hear that, because I know that the long-term care homes all have minimum standards which were raised up by the Ministry of Health once the outbreak had started, and so they're doing an excellent job so far. And I know what's really hard is for people to be separated from their loved ones, and that's the downside of this COVID-19, I guess.
It is part of the pandemic, and my recommendation was to up to universal masking, which means anybody in a nursing home, working in a nursing home, would wear a mask at all times, regardless if there is infection or not. There is a discussion in the province to actually a push to implement this across the province. And I know some of my colleagues, other MOHs in health units, have already had their own recommendation. And again, we reassure the public, we are looking at many angles to this, and it is developing as we speak. It's something that we have not dealt with before. However, we have the expertise, the authority, and the protocols to deploy to address issues as they come. More importantly, maybe our last point is wash your hands. This is what our mothers told us, and it still stands, and it will get us through this outbreak.
Dr. Arra, thank you for the conversation today. And I know that people are watching these videos and watching these shows. So always good to have you on, and we will be talking again. Thanks very much. Stay healthy.